Hello, this is Dr. Grande. In today's video, I'll be talking about some of the complicating factors we see when trying to treat antisocial personality disorder. If you find this video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss any new videos. Now, we talk about antisocial personality disorder. We're talking about a disorder we see in the Diagnostic and Statistical Manual under Cluster B of the personality disorders. This is the dramatic, emotional, and erratic cluster. So antisocial personality disorder is in the same cluster as narcissistic, borderline, and histrionic personality disorder. Antisocial personality disorder is characterized by a number of potential symptoms, including continually engaging in behavior that would be grounds for arrest, lying, impulsivity, irritability or aggression, disregarding individuals' safety, being irresponsible, and showing a lack of remorse. In order to qualify for this diagnosis, an individual has to be at least 18 years old, and symptoms of conduct disorder would have had to have been present before the age of 15. Also, the symptoms can't exclusively appear during the course of schizophrenia or bipolar disorder. So oftentimes when we talk about the treatment of antisocial personality disorder, we hear this term complicating factors. There's this idea that treating antisocial personality disorder is difficult for a variety of reasons, and evidence supports that this is true, that this is a difficult disorder to effectively treat. Now, there are a number of reasons why this is the case, and I'm going to go through a number of those reasons here. The first one we'll look at is the tendency of cluster B personality disorders to have less severe symptoms as individuals grow older. Now, we look at personality disorders in general. We know that cluster A and cluster C personality disorders tend to stay the same as individuals age, or sometimes they get slightly more symptomatic. Cluster B personality disorders are the personality disorders that tend to improve a little bit over time. Not in every case, but sometimes. And we can see this improvement in terms of symptom severity, duration, and frequency decreasing, and we can see sometimes a remission. With antisocial personality disorder specifically, we tend to see improvement in a number of cases when somebody reaches their 40s. Another element is that the comorbidity associated with antisocial personality disorder is challenging. Oftentimes, individuals who have this disorder have comorbid substance use disorders, and oftentimes comorbid personality disorders, particularly the ones we see in cluster B, so narcissistic, borderline, and histrionic. So what this does is it confuses what's actually being treated and what's actually responding to the treatment in terms of symptom characteristics. So if an individual has antisocial personality disorder and substance use disorder, and they're treated and the substance use disorder improves, sometimes that presentation is recorded as an improvement overall, even though the antisocial personality disorder characteristics may not have improved at all. And of course, the same thing applies to personality disorders. Another complicating factor is how improvement itself is measured. Now, we know that with antisocial personality disorder, a number of individuals with this disorder who receive treatment are court-ordered to do so. Depending on the research you look at, about 50 to 70% of male prisoners meet the full criteria for antisocial personality disorder. So in the criminal justice system, the interest may not be to try to improve all of the symptoms we see with antisocial personality disorder, but specifically symptoms related to criminality. So common treatment goals in prison settings, for example, would be reducing the likelihood that somebody would reoffend, decreasing aggression, decreasing substance use. And again, substance use is not a part of the symptom criteria of antisocial personality disorder. Rather, it just is often comorbid. And we also see efforts to decrease impulsivity. So in instances when those treatments are effective, if they're only focused on reoffending, aggression, substance use, and impulsivity, are they really capturing the construct of antisocial personality disorder? If there is improvement across those domains, does that translate to the full criteria of the disorder? So how we measure improvement with antisocial personality disorder and what we focus on during treatment can actually be a complicating factor in successfully treating the symptoms of antisocial personality disorder. Another complicating factor is oftentimes with antisocial personality disorder, we see a lack of motivation. And we know that for a number of mental disorders, lack of motivation can be problematic in terms of receiving effective treatment and seeing a lot of improvement. The last complicating factor I'll cover here is the relationship between mental health clinicians and clients who have antisocial personality disorder. Some of the characteristics we see associated with antisocial personality disorder can create bias on the side of the mental health treatment community, including lack of empathy, arrogance, being opinionated, being cynical, and being callous. These behavioral factors and a lack of experience and lack of training on the part of some mental health clinicians can result in the mental health clinicians being biased, fearful, or discouraged about how effective treatment will be. This complicating factor, as well as all the other complicating factors in terms of how we treat antisocial personality disorder, are unfortunate, because we know that antisocial personality disorder does seem to respond in some instances to treatment, particularly if that treatment has a longer duration and if the mental health clinicians have experience treating that disorder. Yes, antisocial personality disorder is challenging to treat, but it's not impossible to treat. And we see some improvement, of course, as people age, as I mentioned, but the treatment can also be effective. We need better research that's focused on the specific characteristics of antisocial personality disorder, not just the comorbidity and not just the related characteristics like criminality, for example. I hope you found this description of complicating factors with antisocial personality disorder to be interesting. Thanks for watching.